Where's F5? Just F5? There we go. Okay. So you may be wondering why health is being featured at what is essentially an economic conference, and I hope in about 10 minutes I am going to close that loop for you. I would like to say that one of the reasons that we are here is that Richard Opper is very committed to all of the different state agencies working together and working with each other, and he is encouraging us to reach out. So we were really very excited to be asked. The Department of Public Health and Safety is the segment of, or the Division of Public Health and Safety is the division of the Department of Public Health and Human Services that does public health, as opposed to direct entitlement services like Medicaid, Medicare, Child Protective Services, and some of those other functions. And we are in the process of applying for National Public Health Accreditation, which is a new initiative this year. States, departments of health can do it, county departments of health can do it. I know, Gail, you're in the process, aren't you? You're doing it for Lewis and Clark County. It is the first time that a national independent board has set out a series of competencies for public health and a series of criteria for demonstrating that we meet them. And it is an entirely voluntary undertaking, but it forces us to examine our own consciences in terms of, are we doing the right things? Are we doing the right things efficiently? Are we being good stewards of public monies, good stewards of public interests? So the first thing that we had to do as part of that process was to create a state of the state's health, a health assessment. And we did this about 5 years ago, so it was time for us to update it anyway. The data, we started it about a year ago. The data are largely from 2011. That would be our baseline year. And that's pretty much an 18 to 24 month time lag from real time is about what we can manage with most of our data sets. For example, Bruce is just about to release the 2012 annual vital statistics report. It takes us about a year to make sure the data are clean and ready to release. So, all right, am I pushing the wrong button? Am I not aiming it at the right place?
I maybe turned it off.
Oh.
There's on the side.
On the side.
Here.
See, this is why I am not allowed to be technological by myself.
I have one of these and the battery keeps going dead on me, so here we go now. It's
Uh-huh. There we go.
Thank you.
There are three major required elements that we have to put in place before we can even start the process. One is the health assessment. One is a state health improvement plan, which is based on our health assessment, a whole series of things that we would like to see us and our partners statewide, which would include CIP, which would include the Department of Environmental Quality, which would include Department of Labor and Industry, which, as it turns out, includes Fish, Wildlife, and Parks. It's an amazing number of partners that we work with, plus the private sector, plus localities, city, county health departments. A whole series of things that we have identified that we want to work on as a state. We are the lead in some of them. We are interested parties in others. The strategic plan is what the Public Health and Safety Division is committing itself to do as the leaders. And all three of those documents are available at that website if you'd like to look at them. In topic areas that respond largely to our bureaus, we identified the greatest health burdens using morbidity and mortality primarily as the measures, and identified goals for improvements and interventions that we thought would be effective to achieve those goals. There are basically four domains that we are focusing on: policy and enforcement, health promotion and disease prevention, clinical preventive services, which we hope our partners will take on because we don't do a lot of direct services delivery, and surveillance and burden assessment. And as some examples, for policy and enforcement, we will continue to enforce the Clean Indoor Air Act. I got to tell you, I came to Montana in 2005, and I thought Montana was probably the second most leave me alone and don't tell me what to do state there was. Second only to the state I came from, which was Alaska. And I get here in August, and the Clean Indoor Air Act went into effect in October of that year, and I was just stunned. Thrilled, but stunned. We'll continue to endorse that and continue to support and enforce it. We are probably going to go to the legislature and ask for additional tobacco taxes. Spit tobacco isn't taxed very heavily, and it turns out that e-cigarettes are not taxed at all. And there is a real put. Have any of you all heard of e-cigarettes? Mm-hmm. Any of you all ever seen one? Yep. I heard. Oh, that's right. You brought some in, didn't you?
I have some at work.
Yeah, he brought some.
They're good for health. It says right on the package.
There's nothing in state law that says you can't have an e-cigarette on the grounds only because they didn't exist at the time. They're not taxed. We'd like to see them taxed. It's a tobacco delivery system. Even if it doesn't have side stream smoke, secondhand smoke, it's a tobacco delivery system. We're going to be continuing to uphold vaccination requirements for school attendance and daycare. We have that authority in statute. We're doing much better in childhood vaccinations than we used to be doing. We used to be down sort of 47th in the country in terms of having our toddlers adequately vaccinated. We're about in the middle of the pack these days. We're continuing to encourage screening for cancer, early detection, screening for cardiovascular risk factors like high blood pressure and cholesterol. We are encouraging our clinical partners to undertake evidence-based interventions like diabetes self-management, asthma self-management for children in schools, provider and public education about health risks and self-care. For clinical preventive services, as I say, we are not the leader in this, but we are an interested party in coordination through electronic health records, the development of medical homes so people will have seamless care and won't fall through the cracks, targeting particularly underserved groups. Surveillance and burden assessment, we are among the leaders in that, at least for the health aspects of it, and hopefully eventually we'll be able to use what we surveil for evaluation after a while. We have the State Health Improvement Plan, which, as I said, is the one that we hope everybody will engage in. And our role in that is we like to foster interjurisdictional coordination to provide technical assistance to localities, workforce development, both internal for us and external for the state as a whole. We are facing workforce attrition in public health, both nationally and in the state of Montana, that's just overwhelming. We did a survey within the Public Health and Safety Division that we just finished within the last few weeks. 30% of our senior professionals in management will be retiring within 5 years. Yeah. Wow. Bruce and I sit in my office and really wring our hands over this. It's frightening. There are no mid-level, there are a serious lack of mid-level professionals in the pipeline to replace a third of our workforce. And nationally, it's 30% will be retiring within 5 to 10 years. So this is a real worry for us. The strategic plan, which is what public health and safety will do, we have action areas for each of those areas: public health policies, prevention, access to care, system improvement. We're doing very well in some areas. Maternal and child health, we do really well. Our rates of low birth weight and premature birth are pretty low compared to the national averages. Our infant mortality is low. Those are good things. We have very effective response to communicable and infectious disease. Our childhood immunization rates are improving. All three of these things we are very proud of. We don't intend to rest on our laurels with these. We're going to continue working on them. Here are some areas where we're not doing quite so well. This is causes of death by age group, and I don't know how visible the age groups across the bottom are in the back of the room. You'll notice that there are no bars for infants. They mostly die, about 2/3 of babies before their first birthday either die of perinatal birth defects and conditions that arise in the perinatal period. There is not a lot you can do to prevent that. There are some things you can do. We'd like to get women into prenatal care very early on. And women with problems such as diabetes in pregnancy, high blood pressure in pregnancy, have very good management for those conditions. But once you get to, and then about 17% of infants die of SIDS, sudden infant death syndrome. And that is quite preventable. We've cut that rate in half nationally and in Montana. Put the baby back to sleep. You've heard of the back to sleep campaign. Put the baby to sleep on its back. Don't swaddle the baby up. Don't use a lot of soft crib bumpers and blankets and stuffed animals and soft bedding in the crib. When you get to 1 year of age and through certainly through age 34, almost half of the deaths in Montana are due to unintentional injury. I'm not allowed to say accident. The Injury Prevention Program takes it as a matter of philosophy that there are no accidents because accident implies that it wasn't preventable. And they will tell you that all unintentional injuries are potentially preventable. 43% of all childhood, teen, and young adult deaths are due to unintentional injuries. A good portion of those are vehicular injuries, speed, alcohol, and lack of seat belts are involved. Yes, Gab?
I know you break out motor vehicle accidents, but is there any thought about breaking out other types of accidents?
Oh, we can. Yeah, we do.
Can.
Yeah, we do. We can break this into very, very fine. Provided people fill the death certificates out in detail, we can break it out into very fine granular levels. Suicide, you'll see, particularly for 15 to 19-year-olds and 20 to 34-year-olds, and even into the 35 to 49-year-old group, we do have some concern about suicide rates. And you'll see that the yellow bars are cancer, the black bars are cardiovascular disease, and the green bar over there for the 65 and older is respiratory diseases, both chronic diseases like COPD and the acute diseases like influenza and pneumonia for the elders. The chronic diseases start to take their toll after 35. So a couple of things that we're really focusing on. For kids and young adults, we're really focusing on injury prevention. And for middle-aged and older. And middle-aged is a nebulous concept. It's kind of wherever I am and past it.
I relate to that.
Yeah. So chronic diseases is the other area where we have a lot of concern in our programs, in our state strategic plan. This is data from the Montana Behavioral Risk Factor Surveillance System, which is an anonymous random telephone survey about health behavior and health attitude and health knowledge. And two of my staff, Joanne and Emily, are the behavioral risk factor surveillance epidemiologists for Montana. It asks people, for example, have you been diagnosed with? And you'll see 29% say they've been diagnosed with arthritis or something related to it, and it's defined fairly broadly. Osteoarthritis, rheumatoid arthritis, lupus, help me Joanne, fibromyalgia.
It's the whole range of.
Is there one more? I thought there were 5. Anyway, a very broad range.
Sciatic.
It's more than just the osteoarthritis. Asthma, and this is only for adults age 18 and older living not in institutions, although because we've been able to use cell phone calling as well as landline calling for the last 3 years, we now have college dormitory residents. We were for a long time as older teenagers, young adults, and people of lower income were moving more to not having a landline at all and having only a cell phone. We're starting to lose those people in our sample. And the sample is now looking more like the population since we've got good cell phone coverage these days. Asthma is more common than I would have thought. 9% of the adult population has been diagnosed with asthma. They may not have it still. The question is, have you ever been diagnosed with? 8% of the population has been diagnosed with diabetes, not gestational, and diabetes does not spontaneously go away. 5% with a heart attack and 4% with coronary artery disease. Stroke is not here, but as I recall, it was about 2%. And this may strike you as a little low, given the mortality rates on this slide and what I will show you in a minute about the risk factors for these chronic diseases. And this is the survivor effect. These are the people who survived their heart attack or survived their stroke and are not debilitated and are not living in a nursing home or a convalescent facility. They've survived and they're well enough to still be living independently. These are the risk factors for chronic disease: high blood pressure, high cholesterol, overweight or obesity, and smoking. Very prevalent in the population. These are the things that are going to drive. These are the people who are waiting for their heart attacks and strokes.
Eating their way to.
Yeah. The survey also asks people to rate their own health as excellent, good, fair, or poor. And you'll see that 17% of the population says their health is only fair or poor. The green bars are how many days in the past 30 days before the survey have you experienced poor physical health? And more than a third have experienced at least 1 day of poor physical health in the past month. And 13% have experienced 2 weeks or more of bad physical health. That's scary. The orange bars are poor mental health. 11% have experienced 2 weeks or more of poor mental health. And we think that's largely depression. And the purple bars on the far right are how many days in the 30 days before the interview has your poor physical or mental health, or both, caused you to not be able to do some activities of normal life, which could be self-care, it could be work, it could be recreation. Almost 10% of the population has experienced activity limitations due to their poor physical or mental health. So this is a fairly substantial burden. Our health status and a prediction. Aging population, Joe talked to you about this at some length, I think, earlier today. A high prevalence of risk factors for a variety of chronic diseases. And so what we are, this is more than a prediction, I truly am convinced of this. Chronic disease morbidity and mortality will not be decreasing anytime soon. Even if we are very, very successful with the initiatives that we've put in place, it's going to take a while before that curve starts to tick down.
Isn't that natural though, since the population is aging and that's where we mostly would expect to see chronic disease?
Yeah.
So that's not necessarily a problem as much as it's just reflection of?
Well, the population doesn't need to be that sick from that many things. I mean, in theory, if you didn't have smokers and overweight people and people with high cholesterol and high blood pressure and so on, in theory, they could be healthier than they are.
They could just have more accidents.
They could be. No, we don't have accidents. We have unintentional injuries.
Because 100% of us are going to die.
Yeah, we're all going to die at some point. This is true. What I would like to see is that we have a better quality of life until we do, and I also don't see that the quality of life is likely to improve very much in the foreseeable future. Even if the initiatives that we put in place now are really effective, it may be a generation before we see that turnaround. And the potential economic consequences are reduced productivity as people become unable to work, too sick to work, miss 2 weeks or more of work a month. Increased healthcare needs of the population, and I think Cody's going to talk about that in a minute. And because the population is aging, I see a shift in the costs for those healthcare needs shifting from private insurance to the public sector being largely Medicare, to some extent Medicaid. And that's really all I have. And who is next?